Welcome to Living a Bella Vida podcast. This is Erin Schmidt, editor-in-chief of Bella Vida magazine, and I'm so excited today that I'm joined again by Dr. Joy Kong. Dr. Joy Kong is a medical doctor, author, speaker, brand owner, and she has done some incredible treatments, including ketamine therapy. So I'm happy to have her back on the podcast today, and welcome, Dr. Joy.
Thank you so much, Erin. So happy to be back.
Yeah, thank you. So I know there's a bit of controversy around the ketamine therapy because, um, you know, there's, I think, some misinformation. Obviously, there are people that do abuse that drug, but there's some amazing benefits when it's used properly and administered by a medical professional like yourself. So I'd love to learn more about it, and I'll let you kind of tell us what the research is versus what the internet says.
Yeah. So, ketamine has been around since the 1960s. So it's, was used as an anesthetic, which means the doctors were using it to conduct surgery, right? You can cut open a person, the person will be, the consciousness is not with them. So it has that kind of power of separating the physical body with your consciousness. And what's interesting was I don't think people realized what it could do at a lower doses until later on. But what's interesting was that in the Vietnam War era, they were actually giving people these pens in case the soldiers were shot up. They were given either morphine pen or ketamine pen in case of, that they were wounded. And what the fascinating thing was that the people who injected themselves with ketamine as compared to morphine, they never developed PTSD. That's fascinating, right? What is different about this particular drug? What is it doing to consciousness? And then I think when I was in medical school, residency, I vaguely started to hear people talking about using ketamine as a adjunct, as a treatment for depression. So that was in the mid 2000s. So now it's become much more widespread, and people realize that this is a powerful medication because at much lower dosages, a fraction of what they give to do surgery, people actually have a journey. So they end up feeling a little separated from this existing reality, almost like some people say out-of-body experience. Some people liken it to near-death experience, that you are going down somewhere that's really out of ordinary from this reality. In that process, it does change how your brain responds. It slows down your brain to the point where, they've shown it not only being helpful for depression. That's the first thing they studied, is treatment-resistant depression. People who just could not get out of this tough, dark place. Then ketamine was able to lift them right up, within an hour of treatment. I mean, it was incredible, right? So yeah, you can do, ECT, electric shock therapy, that you could achieve something like that. But then they realized ketamine can also do some, alleviate people's suffering that fast. And then they found that to be helpful in anxiety, PTSD, OCD type symptoms, and also chronic pain and migraines. So with PTSD, it's really fascinating because I worked at the VA for 4 years and talked to a lot of veterans, because as a psychiatrist, we do a lot of talking. So there are veterans that I was seeing every week. There's one veteran I saw, for the entire 4 years when I was working at the VA, I saw the same veteran every week for the whole 4 years. And he was a World War II vet, a lot of PTSD. So with all that talking, I still couldn't make much of a dent in the PTSD response, because it's almost like a memory, immediately a trigger of reaction of this, flooding of your sympathetic system, this panic, this just feeling of doom, right? Disaster. But it's too bad that I did not have the tool of ketamine. I think we could have made such a difference, because what happens when you're under ketamine is that when you're thinking about a traumatic experience, instead of your brain having no chance but go from A to B, A being the stimulus, B the response, the drastic response, A to B right away. Ketamine is allowing you to take a little detour. So da, 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 da. Maybe you go to another point, C and D, and then you go to B, but then the B doesn't feel, like you realize, oh, I don't have to be at B because I've gone through C and D. I have a different thought, different idea about what happened. Maybe is not so catastrophic that I can't live my life anymore, right? I can have a perspective on what happened, because let's face it, life can really suck because bad things can happen to you. Let's face it, everybody has bad things happen, right? It's just part of life. But how you deal with it, are you going to move on from it, or do you want to be stuck there? Because PTSD is when you get stuck right at that same spot. Every time you're stuck. So how can we unstuck you? And that's when ketamine can be so powerful. And I really wish that we had the tool. I mean, imagine how much more fun it would be to be a psychiatrist when I can just, oh, your PTSD, oh, you're no longer, having a problem with it. You can live, better, happier life with your spouse and your workplace. And, you can move on with your life. Yeah, it was terrible. It happened, but you don't have to have a terrible life now because of what a terrible thing happened to you then. So one example was a patient who did ketamine treatment. This is a civilian. So trauma can happen to a lot of civilians, right? And this is a guy in his 30s. He had a cat that he loved. We all have some animals we love. The cat was run over by a FedEx truck.
Mm.
So he was so heartbroken that he couldn't even look at the urine without breaking down and just crying and just completely lose it. But after he did ketamine, he said, I was able to take the urine, open it, and take out the little paw print of the cat, and then take the paw print to the tattoo shop and tattoo the little paw print on his arm. It was this healing experience. It's okay. You remember, you can let the good of the memory, right? The good of how beautiful the cat, how much you loved each other, all that goodness, how beautiful, miraculous, and cute, the cat was. Let that be the predominance of your memory. So that's what it can do. And it's incredible.
Mm. You're tugging on my heartstrings. I recently had to put down my kitty cat, and we have her paw print, and I can't force myself to take it out and display it. But I just, I just really miss her. But I don't break down and fall apart. We were there with her at the end. She died peacefully. So, but it was still very sad. So, wow. Yeah. And you're right. People go through trauma of all different kinds: physical trauma, sexual abuse, emotional abuse in relationships, all kinds of things that really can keep you stuck in a certain state of mind, a certain state of thinking, believing that you can't get past. And it can really be debilitating for a lot of people, not just veterans. But what an incredible service to people, especially to our U.S. military, who came back these last few wars with horrible PTSD. You would think that by now we would have figured out how to have people in war and keep them from coming back so wounded on the inside. What are your thoughts on how the psychiatry field could really be revolutionized by this, and why is it not? Why is it not more widely used?
I think probably I don't know what the percentage of psychiatrists are that actually embrace this. What's interesting was I had my first ketamine experience with a anesthesiologist. So he was the one that was, really passionate about this, because he actually was using ketamine, in his, as been doctors, doing anesthesia. What he realized is that for people, because it's such a safe anesthetic, because if you have heart lung potentials, to collapse, you have those predisposing conditions that make you a risky anesthetic patient, he will use ketamine because it's very calm when it comes to heart and lung responses. So when he used those on those patients, some of them were, for example, addicted to opiates. And then he realized when these people wake up from anesthesia, they weren't asking for any opiates. They weren't asking, it's like their pain addiction was going away. So he was very
Wow.
intrigued. And also people were happier. It's like, what happened? So if someone was depressed, anxious, and they wake up and they're happier. So that's what really intrigued him, right? So it's for doctors who were experienced using ketamine, that's how they discovered the power of it. So psychiatrists, I think they I don't really know. I I kind of separated myself from my psychiatry fellow doctors. I know there are open-minded psychiatrists. There are what's called integrated psychiatry, that they are incorporating more full body evaluation, looking at hormones, maybe toxicity, really helping the person to heal. And that's really my beef with psychiatry, because we were not educated that way. We were told, if you meet these criteria of symptoms, we throw drugs at you. These are the drugs we use, and that's what we give you. And these are going to hit the receptors, are going to increase these neurotransmitters, and that's going to fix the problem. And you are not looking at the cause. Why are we having trouble with receptors? Like, why are the receptors not responding? Can you tell me why? Could it be that you have toxic buildup? Could be that hormonally you're not balanced. Could be your microbiome is screwed up, so you don't have the right neurotransmitters. So they're not looking at any of those. What about you're deficient in certain vitamins? If you don't have enough certain vitamin Bs, you're going to be depressed. So why don't you look at these things? So that's my beef with it. So I kind of veered away from that. And, I began to have less and less common language with my psychiatrist, friends, my fellow psychiatrists, because we're looking at things so differently. So I don't know how much they're incorporating it, but I think some of the more forward-thinking, open-minded psychiatrists who are sick of just prescribing medication after medication, maybe they can look at other ways of really jumpstarting the brain. Because what happens with ketamine is not just that it's rewiring. I mean, what does it mean to rewire? Rewiring, when you're doing the wiring network, if you're looking at the circuitry, they're establishing new connections. That means synapses. So the ketamine actually has tremendous ability to promote new growth of all these tentacles from the neurons. So they're promoting brain-derived neurotropic factor. So they're greatly enhancing this ability for the neurons to just find each other and establishing new networks. So that is a fundamental shift in how we can approach mental health. Yeah. So I hope there's more and more. I hope so.
Well, it sounds like it's a sort of starts at the source, right? So the medical field needs to embrace this so that universities are training their psychiatry students on what this drug does and why it could be an alternative to all these pharmaceuticals that are, basically, if you take this and we'll throw a bunch of other drugs in because this one doesn't do this. And I
know.
and I'm not talking badly about the I'm on meds. I don't tell people ever go off your meds until you have a better alternative, because that drug that you're taking could very well be saving your life right now. And I've had people in my life who've committed suicide who were very, very close to me. My father committed suicide 5 years ago. So this is a a topic I'm passionate about, not only because I suffer from depression and anxiety, but because I've seen what it does to people who don't get the right treatment.
Mhm.
And so,
Erin, yeah, well, you're not alone. Guess what? I
Mhm,
had taken antidepressants for 20 years, but, I haven't
mhm,
taken anything, I don't know, for 3, 4 years. After I got into anti-aging medicine, stem cells, when I started to address what may be underlying, what's causing my depression in the first place, is not just a free floating. Some people have depression. There are causes. So if you
mhm,
can address some of these little pieces of the puzzle gradually, then you're putting a human being together better, right? You're forming a better functioning entity. So that's what I think anti-aging medicine, integrated medicine, holistic medicine is trying to do, is to figuring out all these little pieces of the puzzle. So
mhm.
in depression, I remember when I was in medical school, at the end of the medical school, I told my mom, I said, Mom, I think I want to go into psychiatry. She was like, Great, you will never be out of the job because I heard 40% of people are depressed.
I
So,
believe it.
and what's interesting was when I was in medical school, after I, fiercely resisted getting on any medications because I thought it was a willpower issue. Um, and
Right.
but finally, I wasn't functioning too well, so I tried a medication, a Prozac. Actually, I love it, and it completely shifted my chemistry. I mean, that's why I went into psychiatry, because I saw how much light it brought to my life. It really helped me to
Mhm,
be a much more positive, functional human being. So I'm not knocking psychiatry. It's all bad, because I think for certain situations, if you can't address the root causes yet, you've, but you don't want people to suffer, this is a great way. But while you
mhm,
are taking these medications, look at why you got sick in the first place. Don't stop searching for the root causes. So what's
mhm.
funny was, after I got on the medication, I met one of my good friends, just, at a locker place. And I was whispering in his ears. I said, guess what? I'm on Prozac. And then he said, me too. And he said,
Yeah.
so Damon. And I was, what? It turns out like half of us were on antidepressants. It's so funny. It's so much pressure. And medical school, high pressure cooker, and a lot of it's very paternalistic, very hierarchical, and they really, really, a lot of shaming. Yeah, not a happy place.
Well,
Yeah.
and I think just in general in society, there's still this stigma that you're taking a pill. And I hear people, oh, I went off my depression meds. And it's like, well, what are you doing to make sure you don't get back to that place? Because
Right.
if you have chronic depression and you're not doing something for
Yeah.
yourself, it could lead to disaster. And we're
So
seeing
for
a
any,
huge mental health crisis in this country, all over the world after COVID, where, the increase in suicide and the economy is bad. So people just feel hopeless. So, that's why I love talking about this, because the more that we unearth and debunk like myths and stop shaming people for taking what they need to stay
yeah,
healthy, have their brain function so that they don't want to kill themselves or, kill someone else. Lord forbid.
and for your
You
listeners.
know,
Yeah, for anybody out there who is depressed, which we know there are a lot of depressed people
Mhm.
out there. So if you think you're depressed and you are looking at solutions, first of all, I want you to walk 1 hour every day. So just do that. At the same time, look at your diet. Stop eating junk. Stop eating bad seed oils. Stop eating all the fried food and highly processed food. Just start eating healthy, wholesome stuff. And then walk 1 hour every day. And you are, after that, after doing that for a month, and if you're still depressed, okay, go see a doctor, see what you can do. But at first, try that out. I know a doctor who refused to write any prescriptions for antidepressants unless the person has walked 1 hour every day for a month. And most of them, after they did that, well, I guess I don't need the antidepressants. So it's powerful. People are really forgetting the basics. So yeah. So if I can even help one person out there, just start walking. Start walking.
Right. I love it. That's wonderful news. I need to do that more too. I'm
Uh-huh.
guilty of that. Um, so, Dr. Joy, is there anything else you want people to know about ketamine that maybe we haven't covered?
Yeah,
And
so I
then,
want people to
we'll wrap it up.
understand. Yeah, I want people to understand ketamine. People may have questions. Is it addictive? When you do it as prescribed by your doctor, no, it's not. Your body, it's not. It doesn't have the kind of physical dependence associated with it. You may have psychological dependence because you may get stressed and you may think, I need that, that, and not want that to be, a relief. But if you don't take it, it's not like you're going to have withdrawal symptoms, you're going to feel terrible. No. So it doesn't really have the physical dependency. Maybe psychologically you think you need it. But if you do not do it as prescribed and you start experimenting too much on your own, which I know people do, then it could be a slippery slope. But if you are doing an IV infusion 2 or 3 times a week, usually the course of treatment is about um, uh, about was it? I think it's right about 2 weeks. So the initial course of treatment is 2 weeks. That's if you do 3 times a week. So you can spread that out. You can do it, a little farther apart. So 6 sessions. That's to help your brain to kind of rewire, because if you're establishing new connections and then you just go back to your day-to-day life and getting stressed about the same thing, then your old circuit may reform, right? Because you get habituated with what your brain, how your brain responds. So if you want to strengthen a new type of connection, then you need to go back and do another session. So usually 6 sessions is the first round. And then you can slow it down, do it, every 2 weeks, once every 2 weeks, or, initially maybe once a week. If you're severely depressed, once a week, and then once every 2 weeks, and then once a month, and then maybe once every few months. Maybe you don't need it ever again. So that's kind of the process. Just people have an idea. 2 to 3 times a week for 6 sessions, the initial stage.
Wow. That's powerful because, most people it's like, well, you're just going to be taking this for the rest of your life if you have chronic depression. So
No,
that's
we're rewiring.
revolutionary. Right. That's
But
amazing.
even it's interesting. Even executives, highly successful people, they may not be depressed, but some may want to have a different perspective because it does take you out of this clench of this life of the struggles, and it gives you a whole different way of looking at things. So some people like taking a different perspective. So that goes into the whole other psychedelic, that realm of taking you out of the bustles, hustles of our daily life, and looking at things from a bird's eye view.
Interesting. Yeah. Stress is a killer, right? So if you can de-stress your body and maybe think of things differently so you're not immediately going to, or it's overwhelming. I can see where that would be great. So Dr. Joy, thank you again for enlightening us more on all these amazing therapies. People can find you online at Chara Health. And
They can
they
also
can
follow
call
me on
you.
Instagram at just Dr.Joy_Kong, Kong. Yeah. So I always respond to
Wonderful.
people's comments. People, feel welcome to reach out.
Yeah, even if they're not in California, they can still learn from you and find someone in
Yeah.
their area. So
And of course,
please go and like, I'm sorry, what'd
people,
you
if
say?
we only talked about ketamine, but I do not infrequently combine stem cell therapy after ketamine treatment, I think it's going to be synergistic because the stem cells are going to help your, reduce the inflammation, promote more neuroregeneration. And the ketamine is releasing more brain-derived neurotropic factor, right? Helping your brain to promote the production. So the two together can be really helpful. But I think that's worthwhile to mention, that we have so many tools. And I also combine different light therapy, so energy therapy, peptides into the treatment. So people have some significant issues, brain health, mental health related, or any other issues. I think, we have some really powerful tools.
Wow. That's really fascinating. Wow. Thanks for bringing that up. So thank you again, everyone. Make sure you go and like and subscribe. Go and find Dr. Joy Kong on YouTube, on podcast. She has a lot of information, and she's an incredible educator on these topics. So thank you again for being here. And thank you, Dr. Joy, again.
Thank you so much, Erin. It's been really fun chatting with you.
Yes, you too, as always. Thanks again. Bye-bye, everyone.